नमस्ते बिटिया, हमेशा खुश रहो बिटिया। Myself, JV'n Dr. ASTHA SIKARWAR, Assistant Professor, Department of Organ of Medicine, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is from JT Kent Philosophy, Perfection of what is curable in disease, curative in medicine, and the application of last to first. As in Organ of Medicine, aphorism 3, Dr. Hahnemann said, if the physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, if we clearly perceive what is curative in medicines, that is to say, in each individual medicine, and if he knows how to adapt accordingly to clearly defined principles, what is curative in medicines, to what he has discovered to be undoubtedly morbid in the patient, so that recovery must ensue to adapt it as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him, as also in respect to the exact mode of preparation and quantity of it required, and the and the proper period for repeating the dose, if finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judicially and rationally, and he is a true practitioner of the healing art. As we already studied aphorism number 3, जिसमें डॉक्टर हैनीमैन ने अलग अलग नॉलेजेस के बारे में बताया था, अब इस पे पॉइंट ऑफ व्यू डॉक्टर कैंट का क्या है वो हम देखेंगे. The physician must perceive in the disease that which is to be cured, and the curative indication in each particular case of disease is the totality of the symptoms, that is, the disease is represented or expressed by the totality of the symptoms, and this totality, which is the speech of nature, is not itself the ease of the disease, is only represents the disorder in the internal economy. This totality, which is really external, a manifestation in the tissues, will arrange itself into form to present, as it were, to the physician the internal disorder. The first thing to be considered in a case is what are the curative indication in this case. When you have to treat a patient, the first piece of information that you need is what is it that you need to treat. Is it the symptoms, the pathogen, the pathology, the nosological disease, or the person as a whole? Hahnemann says that you have to know what is curable in every individual case of disease. This means that the focus of our treatment should be the individual who has the disease. Now, this causes confusion for many. People think they have to focus all their attention on the person, the individual, and often ignore the disease. You have to find a remedy which best covers the disease process, the pathology, the individualizing symptoms, and the personal constitutional traits. And for this, you have to study the person with the disease picture, and then you have to differentiate one patient suffering from a particular disease from other patients suffering from similar condition using the causative factors, individualizing characteristics of the case, and the rare, peculiar, and uncommon symptoms. If a person comes to you with malaria like symptoms, you will not give her calcarea carb because she is timid, irresolute, and fat. You will first find out medicines which cover the patient's disease process, be it acute or chronic, and then you will study the patient for the individualizing characteristics. What is it that differentiate this patient of malaria from other similar patients? So the first piece of information that you need for curing a patient is a thorough knowledge of the disease process and visualization. Now, you need to have the knowledge of the medicine that you will need to target the disease process. You will need to know what medicines are available, what symptoms and conditions they cover, and how to differentiate one medicine from other medicines producing similar symptoms. This means that you should have a good command over materia medica. You have to use your knowledge of materia medica to select the best remedy from this group of possible remedies. You have to match the medicine with your target, the simillimum, the disease process. You have to find out the most suitable remedy for the case at hand and then use it properly to eradicate the disease process and restore the health. But a medicine does not become a simillimum for a case just because the symptoms match. A medicine will assist in curing a case only if the symptoms match, the potency match the intensity of the presentation and the totality of the case. The dose, which includes the potency, form, and the quantity of the medicines, are appropriate. The medicine is repeated appropriately. Each of these points needs further elaboration. I will offer some brief insights here. You need to understand what are the common symptoms of the nosological disease, what are the uncommon symptoms that this particular patient is manifesting, and what are the personality traits. The symptoms need to be analyzed and evaluated before they can be used for finding the right remedy. The choice of the medicine and the dose will also depend upon your aim, whether you wish to palliate or to cure. Now, you have the knowledge of the disease and the knowledge of the medicine. Plus, you have also decided the right potency and dose. There might still be many cases which will not show a curative response even with the simillimum. If you have do not address the causative, contributing and maintaining factors for a disease condition, even your right remedy will not be able to bring about a radical cure. The patient will improve and relapse. So, the tools that are essential to cure a sick person, a good physician must have the knowledge of the disease and individualization and knowledge of materia medica. If you develop a good understanding of all these variables, you will be able to perform many ideal cures. The physician ought to have a well grounded idea of government and law to which there are no exceptions. He ought to see the cause of disease action to be from the center to circumference, from the innermost of the man to his outermost. Whenever the system of central political government is not bowed to, anarchy and the loss of confidence prevail. There are also commercial centers if sorry in man, the center of government is in the cerebrum, and from it, every nerve cell is governed. Disorder in the vital economy is the primary state of affairs, and this disorder manifests itself by signs and symptoms. In perceiving what is to be cured in disease, one must proceed from generals to particulars, study disease in its most general features, not seen upon one particular individual but upon the whole human race. Now, when the physician sees, as it were in an image, the nature of disease, when he acquainted with every disease to which we are subject, and when he sees the nature of the remedies in common use, just as clearly as he perceives disease, then on listening to the symptoms of of a sick man, he knows instantly the remedies that have produced upon healthy men's symptoms similar to these. This is what paragraph 3 teaches. It looks towards making the homeopathic physician so intelligent that when he goes to the bedside of a patient, he can clearly perceive the nature of the disease and the nature of the remedy. It is a matter of perception he sees with his understanding. When a physician understands the nature of disease and of remedies, then it is that he will be skillful. So, for a homeopathic physician, knowledge of disease and knowledge of maternity is very important for to be a successful and skillful homeopathic physician. This session powered by digital version 2.0 Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention it in comment box. I will resolve it. Thank you.